I wanted to take the opportunity today to talk a little bit about rater training and to go through a few exercises in advance of scoring videos for the model fidelity study. The objectives of this presentation are to allow us to understand some common sources of rater error that crop up in performance assessments, and then specifically to review the checklist line items that are going to be scored for body wall, subcutaneous tissue, and skin. Also to review the global rating scales that we use for sort of more general aspects of the performance, including respect for tissue, the time and motion analysis, instrument handling and knowledge, and the flow of the overall operation. And we're evaluating these basically to standardize scoring for those common mistakes that we anticipate seeing as we're scoring these 3-layer closure videos. I included in the email to you an article about rater errors, and I wanted to highlight a few of them that I feel that may be slightly more likely to affect us as we're evaluating these videos. One of them is the assimilation effect, and this is where raters may provide ratings that they feel are most likely to be similar to other raters. And so this is important that we each make our own evaluations of the videos and not attempt to just be similar to what other people might comment on it. Now there's a central tendency, and this is when raters choose to sort of overuse the middle categories, even though there are, those ends of the scale values that are important to use as well. And so we're going to be scoring on a sort of a 4-point scale. And so if someone is scoring with a central tendency, we tend to see them in the 2 and 3 range. We also may see drift, and this is where we have raters whose ratings become more harsh or lenient with time. And I've found that I experience that sometimes when I am perhaps getting tired and paying less attention and tending to get more lenient, or if I keep saying the same error over and over, sometimes I tend to start rating that a little bit more harshly as time goes on. And then there's a repetition factor, and that's where we may end up lowering a score inappropriately because we've seen similar performance repeatedly. So that's what I was talking about, seeing the same mistakes over again and starting to penalize those more heavily just because they're common errors, or perhaps the opposite, seeing them so commonly that we feel that we shouldn't penalize them. And so that's potential for error from repetition factor. Other errors include a first impression, and that's where the rater may make a judgment based on their initial opinion the first few minutes of the video, and have that opinion be difficult to change through the rest of the video, where we know some of our students may start slowly and kind of work up to ending better. And so sometimes those first impressions aren't really reflective of the student's entire performance. Skimming, and hopefully none of us are guilty of this, or at least we won't admit to it in public. And this is when we evaluate a limited portion of the performance and still provide a score for the entire performance. And needless to say, these are relatively short videos for 3-layer closure, so hopefully we can avoid having skimming as a rater error. And then the halo effect. This is where the rater gives the student the benefit of the doubt and gives a high score. So this may be in cases where we don't feel comfortable giving a score, where we don't feel comfortable assessing, or perhaps where we were looking away or writing down and didn't happen to see certain aspects of the performance, or maybe where the student just, the performance fell off a little bit, but we're trying to give them the benefit of the doubt that they seem to be working hard, they seem to be doing things right, and we reward that with a high score that maybe isn't completely warranted. And finally, the Gestalt phenomenon. This is where we provide ratings based on an overall impression, simply because we're not able to differentiate particular aspects of the performance. And so in the case of the model fidelity study, we're scoring both on a checklist item as well as a global rating scale. And naturally, those global ratings are going to be based on an overall impression, and that's okay. But we want to, when we're working with the checklist, keep those from turning into overall impression scores. Those are very task-based scores, and that task needs to be observed in order to differentiate the performance between students. And then there's also rater error that's associated with trait, and that's where we focus on one particular aspect of the performance, and we give too much weight to that when we're determining the score. And so this may be sort of an area where we might find like a personal pet peeve, like instrument handling or suture management or something like that, that is sort of one thing that we get fixated on as an individual and perhaps miss some other aspects of the performance and scoring those correctly. So we do want to look at the performance as a whole, and so go through the checklist and go through those items, and then look at the overall impression when we're doing global rating scale, but try to stop from getting hung up on one particular aspect and scoring perhaps the others lower or higher because of it. When we work through the checklist scoring for our students, we're going to be using a 4-point scale. And so the first score, it's actually a 0 to 3 scale, and the first one is a 0, and that's basically an unsatisfactory performance. And so that's simply a student who fails to perform the skill at an acceptable level. And that raises questions, well, what is an acceptable level? And hopefully that'll become more apparent as we go through some of the rest of the scale. A 1, this is a student who is really borderline. Their performance was very marginally acceptable. So perhaps they performed the skills with a noteworthy or significant flaw that was present. There's a pretty significant issue that's there, but it's not quite enough to, say where you would be failing or unacceptable as far as performance goes. A 2, this is where a lot of our students are going to fall who just do a good workman-like performance. And so these are students who perform the skill, and maybe there's minor flaws in it or revisions. They may have to perform the skill twice to get it right or something like that. But these are a good competent student level would be a 2. And then a 3, this is an excellent performance. And so this is a student who performs the skill competently and fluidly on that first attempt. And so in general, when I'm rating, I tend to reserve these for students where in watching it, I don't feel like I'm watching a student. I feel like I'm watching someone who is very competent at these procedures and perhaps does them on a more routine basis. And so for that reason, I tend to award 3s relatively sparingly, although I certainly do use them. The first item that we have on the checklist for scoring the body wall is an adequate bite size, and that's defined as a measurement of 5 to 10 millimeters. And the bite size is the distance back from the cut edge that the needle is going to be passed through the tissue, and then it's brought up perhaps in the middle, and then the distance that it's passed through the tissue on that near side. So this is, in other words, the amount of tissue that's grasped in the suture as it's tied. And so some examples of what we might see for the different scoring levels. If we have a student who scores as a 0, this is going to be a case where most or all of their bite sizes were either less than 5 millimeters, which is incorporating too little tissue for a secure closure, or perhaps they were greater than 10 millimeters, which is incorporating too much tissue and crushing that into the sutures. A student who scores as a 1, that's a borderline score, maybe because some of the bites they placed were less than 5 millimeters or were greater than 10 millimeters, and they didn't go through and correct those, but those were left there. But they didn't reach the point where most or all the bites were that way, so maybe this was an issue that we were starting to be concerned about, but not one that we felt was completely unacceptable for that student. 2 is a score that's good. And so maybe this is a student who placed a single bite that was less than 5 millimeters or greater than 10 millimeters. Or maybe this was a student who required multiple attempts to get that adequate bite size, but did end up in that adequate area. And a 3, an excellent student. This is a student who consistently places their bites 5 to 10 millimeters on the first attempt without having to go through and do revisions, and generally just sort of did a really good job on this measurement. The second checklist item is for body wall, and that is adequate bite spacing at 5 to 10 millimeters. And so this is a distance in between body wall sutures. So if we have a student who scores a 0, that may be because the spacing between all of the sutures they placed on the body wall was less than 5 millimeters or greater than 10 millimeters. And some of our students placed more or fewer body wall sutures. So it may be that they only placed 2. Some of them may have placed, an entire line of 5 or 6 sutures. So we may see that, we see consistent mistakes in these body wall spacings, and that's going to be an unacceptable, unsatisfactory outcome. A borderline student, or a 1 student, is going to be where the spacing between the sutures was left as less than 5 millimeters or greater than 10 millimeters in some cases, but not in others. In other words, this is a student who inconsistently spaces their sutures, with sometimes appropriate, sometimes not appropriate spacing, or the student had to replace their sutures multiple times to get to that 5 to 10 millimeter spacing, It may have created some excess tissue trauma in the process of replacing those sutures, take up a lot of time, and the efficiency suffered. 2, or a good student, they have the distance between their two sutures at 5 to 10 millimeters. But that was only attained after they corrected an error in that, and that may have been placing a suture in between the two sutures. That may have been removing a suture and replacing it. So however they chose to replace that suture. A 3, or an excellent student, this was where the spacing was consistently appropriate the first time that they placed these sutures, and they were placed in an efficient manner. The third checklist line item is in relation to the linea layer that's incorporated into the bite. And so what we want to see our students doing is just the ventral or external rectus fascia in that closure, as opposed to including external rectus fascia, abdominal musculature, and internal rectus fascia, which tends to not strengthen the closure but does increase pain because it does crush that musculature as the student's tightening that ligature. So in an unsatisfactory student, we're going to see that they include all the abdominal wall layers in all of their sutures. A borderline student may include all the abdominal wall layers in some sutures, but in other sutures, they correctly just include that external rectus fascia. Or perhaps they just create an excessive amount of tissue trauma in the process of getting that correct layer. You find they're peeling it back, and they're being overly harsh with the tissue and creating a problem that way. A good student is going to include only that ventral rectus fascia in nearly all of their sutures. So you may have a case where one of the sutures does include a section of abdominal wall musculature, and certainly that can happen. Or perhaps, the sutures may have been replaced to include only that layer, so the student went through and placed the sutures full thickness in that abdominal wall, and then later revised it so that they were including only that layer. An excellent student has included only that appropriate layer on the initial placement of the line. In other words, has done it very competently the first time. So a couple common mistakes and common questions that might arise as we're evaluating the body wall is, what if the student sutures the wrong layer? In other words, they may be mistaken falciform fat as body wall and sutured that instead. And so because they sutured just plain the wrong tissue, they're going to receive zeros for those body wall items is how we're going to go ahead and score those. You can't acceptably close the body wall if you simply aren't suturing the body wall. Which then raises the question, what if a student starts to suture the wrong tissue, but then corrects the problem and cuts those sutures out perhaps, and then places them in the right tissue? And so in this case, this is going to be a 1 or 2 for all 3 of those items. And because you're certainly not going to be at a 3, which is excellent the first time around. Well, that didn't happen. But they did end up correcting it, so we're not going to give them a 0, which is an unacceptable score. So we're going to be in that 1 to 2 range for all 3 of these items in the body wall. And in general, I would use a 1 if the student has completed the entire closure before they correct the mistake. So in other words, they've done a good bit of this falciform fat, and it's taken them a while to realize they've really suffered as far as efficiency, and then they go through and they cut them out and they have to replace the entire line. I find that a borderline sort of situation. On the other hand, I would use a 2, which is still a good score, if the student was sort of transiently concerned, me by going to that falciform fat, but they realized within a suture or 2 that they were incorrect. They cut out the sutures and they went ahead and did the body wall. So we're going to be in that 1 to 2 area depending on how long the student, spent going down that wrong path. So what if we have instrument handling or tissue handling that's consistently poor? And so when we have a pattern that's performed with consistently poor instrument or tissue handling, that's going to be penalized by losing 1 point on each item. So in other words, if I had a student who would have gotten 3s, perhaps on all of these items, but they had very poor, consistently poor instrument handling or tissue handling. In other words, it's not a transient mistake, but we're consistently having pretty significant issues with either of those problems. I'm going to go ahead and knock those down to a 2 because of that sort of consistent problem associated with it. which raises a question, what if knot security is consistently poor? So as they're placing these sutures, perhaps they're throwing half hitches in there, not noticing. And in this case, we're going to actually table that issue, and we're going to evaluate knot security on the sub-Q and skin closure items. There is not a specific knot security item in the body wall, so we're not actually going to evaluate it there. When we get to that fourth line item, we've started into the subcutaneous tissue closure. And so that fourth line item is that they correctly bury the knot at the start of a pattern. So an unacceptable scenario is that we don't even really see that the knot that's tied really resembles a buried knot. Student doesn't seem to understand the concepts associated with it. They may be tying completely superficially or not be aware of how to place this at all. A 1 is a student who understands the basic concept. They need to tie deep to bury it, but they do make a significant error in the process. Perhaps they tie a deep end to a superficial end, or they tie deep ends over top of a superficial suture. Maybe they have multiple uncorrected half hitches that are negatively affecting knot security. So in other words, this isn't something that's probably likely to threaten the overall health of the patient, but they haven't correctly buried the knot as they've been performing this. An example of a 2 would be a student who buries the knot, but they don't manage to do it on their first attempt. So maybe they had to place a pattern once and they didn't get it to bury, they replaced it. Or the student may have thrown a single half hitch, but not something where you're globally concerned about knot security with that student. And an example of a 3 is going to be a student who buries that knot very competently on the first attempt. They're not having half hitching, they're not having other threats to knot security. It's just a really good quality buried knot. The fifth item on the checklist is that the simple continuous pattern was placed correctly. And so this is whatever happens in between that first knot and that second knot. So an example of a 0 is going to be a student who did not acceptably perform that pattern. And when they're performing that pattern, you should see them taking bites superficial to deep on the side opposite them and deep to superficial on the side near them, so they're grasping a good bit of sub-Q in those sutures. So a 0 may also be a student who backhands the entire pattern. In other words, they take a bite on their near side first before going to the far side, and that's going to be incorrect because it's less efficient and less accurate than the regular forehand placement of this pattern. An example of a borderline student would be a student who performs the pattern and they have some error or errors in there. For example, they may have missed a bite, the spacing is quite off, or the suture accidentally interlocks while they're doing the pattern. Perhaps they're not including quite a thick enough bite of tissue in the closure as we'd like to see to eliminate the dead space there. And then a 2, a good performance, this is going to be a student who performs that pattern correctly, but only after they corrected a mistake or 2 in the process of placing this pattern. And a 3 is going to be that student who performs the pattern correctly on their first attempt at placing it and just does a very workman-like competent placement of this pattern. The sixth item on our checklist is that they correctly end the subcutaneous tissue closure with another buried knot. And so similar to item 4, this is scoring that buried knot. And so again, a 0 is going to be the student who really does not appear to know how to tie and bury a knot correctly. A borderline student is going to be a student who understands the basic concept that they need to tie deep, but they make one significant error in the process. So maybe they tie to the wrong loop. Maybe they tie a deep end to a superficial end. Maybe they tie over top of a superficial suture. They may have multiple uncorrected half hitches that you're concerned are going to negatively affect knot security. And you'll especially find that those uncorrected half hitches, those are particularly a problem with this number 6 item, which is that ending on the buried knot. And the reason is because they have to tie to a loop. And so we see a lot of them half hitching unknowingly when they're tying to a loop. And so you want to particularly watch that area as far as knot security goes. A good performance, student buries the knot, but perhaps not on their first attempt. They may pull up multiple loops before they decide on the right one. This may be a student who has a single half hitch in there when they're tying to the loop, but the other ones are correct and appropriate. Now, that excellent student is going to be one who buries the knot on that first attempt without any half hitching and without any threats to knot security. So some questions that may arise as we're going and scoring subcutaneous tissue is, again, what if that instrument handling or tissue handling is consistently poor? This is a student whose thumb is perpetually falling through the ring of the needle drivers, or who is palmed their thumb forceps consistently, or a student who is just really yanking on the tissue. And so we're going to penalize consistently poor instrument or tissue handling, again, like with the body wall layer, by decreasing 1 point on each item. And so if the knot quality is consistently poor, is a student penalized on both items 4 and 6? So if I'm seeing them throwing half hitches in there and they're consistently doing that, do I take away points for both of those? And the answer to that is yes. So poor knot security is going to be scored as either a 0 or a 1 for both items 4 and 6, depending on the rest of the performance. So if the rest of the performance is great, then I'm going to put this as a borderline student because we've got poor knot quality. If there are flaws in the rest of the performance as well, so in other words, we're not bearing the knot because we're picking the wrong ends or the wrong loop or things like that, and we've got poor knot quality, then I'm going to go ahead and score this as a 0 or an unacceptable performance. Sometimes in watching the videos, we may have a case where it's difficult to see if the knot actually buried. And that's just because of the video angle and finding that, you're the video cameras were up in the surgical lights, and it sometimes is difficult to tell depth from there. So if you're watching a video and you can't tell for sure if it buried below the tissue layers, what I want you to do is go ahead and score the student on the steps to performing the task. In other words, deep to superficial, superficial to deep, and then they tied the knot. If they perform the correct steps, the correct superficial deep bites and so on, tied correctly, we're going to assume that this knot went ahead and buried. So in other words, if I felt that they performed the steps excellently, then I'm going to score them at a 3, even if I can't actually tell if the knot buried below the tissue because of the angle. So if a knot doesn't bury either that first knot or that last knot because they placed it incorrectly, do I also take off a point for the pattern being placed incorrectly? And the answer to this is no. We want to use that checklist item number 5 for basically what happens in between those two knots. So that's going to include things like, was the pattern correct? Did the suture interlock at any point? Did they miss bites? Did it pull through tissue? Did they take the right amount of tissue in that? Did they put the sutures in the right tissue in that subcutaneous layer, and so on? So some other questions that may come up with subcutaneous tissue is, what if the student backhands the entire pattern or places the pattern with the needle facing away from themselves? And we are going to score that as a 0 on the correct placement, or the number 5 line item, because it's simply not an accepted method of placement. It's less accurate, it's less efficient. However, some acceptable variation of the pattern will take a single backhanded bite while they're starting the pattern, and that's not going to be penalized, but they certainly should not be placing the entire pattern backhanded. What if the student places the pattern from non-dominant to dominant hand? Most of us probably suture this pattern from dominant to non-dominant, but we are going to count this as an accepted variation and not penalize it unless it causes issues for the student as they're placing the pattern. So in other words, if a student is placing the pattern from non-dominant to dominant, they may have trouble with the suture interlocking, and so we would potentially go ahead and penalize that, but we're not going to penalize a student simply because they went from non-dominant to dominant. And line item number 7 is that the simple interrupted or the cruciate pattern, or some combination thereof, is placed appropriately in the skin layer. So 0, I don't imagine that we're going to have too many zeros because these are very simple patterns, but a 0 would be just that the pattern is performed incorrectly. Student doesn't appear to know what they're doing from simple interrupted or cruciate pattern, and the sutures that are placed really don't fall into those categories. A borderline student is going to be a student who performs the correct pattern, but they make some error in the placement. So maybe they backhand the simple interrupted as opposed to doing it a forehanded pattern. Perhaps they create excessive tissue trauma by peeling the skin back from the subcutaneous layer while they're passing needle drivers through, just that there is a significant enough issue there. A good student is going to place the pattern correctly, but perhaps they require more than one attempt to do so. So this is the student who doesn't like where the needle came up, and so perhaps they pulled the entire suture out and replace it. They're unhappy with the tension, they cut it out. So this affects efficiency, but the final product is still good. An excellent student is going to place that pattern correctly on the first attempt. Line item number 8 has to do with the tension on the completion of the closure. And in general, we want skin to be opposed edge to edge, but we don't want it to be too tight. And so if we have a closure that's too tight in our small animals, we then have tissue swelling take place and the sutures are then even tighter. This is a case where that starts to cause some pain and discomfort for our patients. So the example of a 0 is either that the edges are not opposed, so we're seeing subcutaneous tissue as opposed to just seeing skin tissue. Or perhaps the suture is very tight. And by very tight, we're going to say it's causing the skin to bunch, evert, or face outwards, or overlap significantly. And so therefore, we're going to say that those sutures are very tight, and we're going to count those as unacceptable. A borderline student is still going to have some issues with the tension of the final suture. Maybe they're a little bit too tight or a little bit too loose, but they're not into the extremes that bring this to an unacceptable level. A good student, the suture tension is appropriate, but maybe they took more than one attempt in placing it. So they placed an initial suture, it was either too loose, it was too tight, they cut it out, they replaced it, that's going to be a 2. And a 3 is that the suture tension is appropriate on the first attempt the student places the pattern. So some questions that come up again with skin. If the instrument handling or tissue handling is consistently poor, we're going to penalize that by losing a point on each of these 2 items. And as far as knot quality, if that knot quality is consistently poor, we're going to penalize that in item 7, and that's that our simple interrupted or cruciate pattern was placed properly. So we're either going to score that as a 0 or a 1 if we have poor knot security. A 0 is going to be a case where there was something else that was problematic with this pattern besides poor knot quality. So perhaps the sutures were backhanded or something else is wrong with it. A 1, a borderline performance, is what we're going to give if we have poor knot security, we've got some consistent half hitching in there, but the rest of the pattern is placed correctly. And now we get on to the global rating scales that we're using for assessing this. And these are based on a general global rating scale developed for human surgery and has been applied to a number of different surgical procedures. And so the first of these global rating scales is a 1 to 5, and it has to do with respect for tissue or tissue handling. This is an anchored global rating scale, which means that they have put verbal descriptors on 1, 3, and 5 to help us know what we're choosing as far as numbers goes. And so that 1 is going to be frequent or unnecessary force on the tissues. Maybe the student caused damage by inappropriate use of their instruments. Then it brings us to the center of the scale at a 3. This is a student who was careful handling the tissue, but occasionally they caused some inadvertent damage. So some of our novices are going to fall into this category. They're trying to handle that tissue well, but sometimes they are causing some damage. And then the 5 is the consistently good handling of that tissue. It's appropriate. There's minimal damage to the tissue, just what we would expect to see if we have an expert performing the surgery. So in trying to differentiate which students would fall into a 1 to 5 area, I have picked out a couple words in these definitions that I think really helps to guide me as far as which section of the scale the student should be in. And so what I see these being is that 1 is you're frequently having poor tissue handling. 3 is you're occasionally having poor tissue handling. And 5 is you've really got minimal tissue handling issues. So highlighting those words helps to guide us as far as respect for tissue. And some of the common mistakes that we may see with respect for tissue handling is one of those is getting too many fingers, and that usually is the index, middle, and ring finger onto the thumb forceps simultaneously so that the crushing power is increased. So those thumb forceps should be an extension of the thumb and index finger. Sometimes you'll bring that middle finger on the forceps as well to sort of guide a little bit better and stabilize, but we shouldn't see the entire hand rotated onto the thumb forceps the way we do in the picture, and simply because it just creates too much crushing power that tends to damage the tissue. Peeling one tissue layer away from another, sometimes in an effort to increase visualization, sometimes just pulling on those layers excessively, that's going to create extra dead space, and we want to avoid that. And just the general pinching and pulling with the tissue with those thumb forceps, so lifting too hard, pulling that tissue a little bit too forcefully, and that's what we're going to see mistakes from a thumb forceps standpoint. We also can see mistakes with tissue handling that are made with the needle drivers. And so one of those is going to be, in general, not following the curvature of the needle when you're drawing the needle out of the tissue. And so what you should see is a student drawing the needle drivers out of the tissue following that curvature of the needle. So you shouldn't see a lot of deviation right or left, or that the student's pulling up or pushing down as they're pulling this needle out of the tissue. If you see a tissue being pulled along to the side, or you see the student having to exert more effort on it than they should have to, that may be a sign that they're not following the curvature of the needle. Failing to lock the needle drivers before going through tissue is also a mistake. We want to decrease any wobbly nature of that needle as it's passing through tissue. Or grasping tissue with the needle drivers, which is inappropriate use of that instrument. You may also see choking back on the needle or grasping it very close to the swagged end, and then struggling to pass the needle through the skin, and as a result creating some excess tissue trauma there. Or grasping the needle directly on the tip, particularly when drawing the needle out of the tissue, and that crushes the tip and results in a dull needle, which then creates problems as the suture is placing the rest of the pattern. The second global rating scale measure is for time and motion, and this is a measure of efficiency and economy in motion. And so a 1 is we have a student who's just creating very many unnecessary moves, whereas a 3 is a student who is pretty efficient in time and motion, but they do still have some unnecessary motions that are decreasing their efficiency. And a 5 is clear economy of movement. In other words, the student is only taking those measures that are needed, and they have a maximum efficiency as a result. And some words here to highlight help you decide where the student falls on a 1 to 5 scale. When we look at unnecessary motions, many of them is going to put us at a 1. Some of them puts us at a 3, and that maximal efficiency is going to put us at a 5. Some common mistakes that we see in this category would be students who set down and pick up instruments frequently, whether that's going to be setting them down on the model, setting them down, on the cadaver, or setting them down on the instrument table. This is a student who is picking up and setting down a lot, and that's decreasing their efficiency. Or not putting the thumb forceps in resting position while they're tying knots, so they may be setting those down. Or gathering the suture material when it's actually not time to tie a knot. So it's more efficient to go ahead and keep passing the needle through the tissue and drawing suture through, but not actually gathering it up in the palm. The third measure in our global rating scale is instrument handling or knowledge, and so in this case we're looking at awkward use of those instruments really. And so when we have a lot of tentative or awkward moves or inappropriate use of the instruments, that's going to put us at a 1. A 3 is when we have competent use of the instruments, although we occasionally see some awkwardness creep in the way that we're handling them. And a 5 is just fluid moves with the instruments as though they're an extension of the hands, no awkwardness associated with it. And so the words here that I think will guide us to numbers would be just 1, this is an awkward instrument handling. 3, we're competent, but we occasionally have some breaches. And 5 is where we're at really fluidity as far as instrument handling. And so some of the mistakes that we may see with the needle drivers for instrument handling is that thumb falling through the ring of the needle drivers. And if this is happening and the student is correcting it and noticing it promptly, it's not something that I'm too concerned about because the student is correcting it and is going to get this right. When I have a student who doesn't recognize that they're doing it and they spend the entire pattern or the entire process with the thumb going through the needle drivers, this is one of the students that I am going to penalize for instrument handling mistakes. Also, we want the thumb and the ring finger in the rings of all ringed instruments. So this is our needle drivers, this is going to be our scissors as well. You need to make sure it's the thumb and the ring finger the student is using. Occasionally you may see a student who has to use 2 hands to lock or unlock the needle drivers, perhaps because of weakness or awkwardness in their motion. Or they may use their fingers to retrieve the needle from the tissue instead of using their needle drivers or the thumb forceps. So after they place the suture, they're getting ready to grab the needle, pull the suture the rest of the way through the tissue. They should be retrieving that needle from the tissue with the drivers. There are also some instrument handling mistakes that are made with thumb forceps. So one of them is palming the thumb forceps, and so that is putting the thumb forceps still as an extension of that index finger and thumb, but the sort of peak of the triangle is within the palm instead of being outside the palm the way that it should be. We may also, in this case, get too many fingers, the index, middle, and ring finger, like the previous picture, onto the thumb forceps and increase the crushing power. Or we may set down thumb forceps while we're tying knots, rather than keeping them in the resting position. Some other instrument handling mistakes would be setting down instruments anywhere except on the instrument table. So we don't want to see instruments set down on the patient table. This poses a risk of dropping instruments, contaminating them, or having them go into a body cavity and not realizing it. We mentioned dropping instruments, or using instruments for something other than their intended purpose. Needle drivers are for grasping needles and for suture. If we're using them on tissue, we've used them for the wrong purpose, and so we're going to penalize that in instrument handling. Or just in general, really awkward, jerky movements that indicate that you don't have a good comfort level with these instruments. And the final global rating scale measure is for flow of the operation. And this is going to be, again, a 1 to 5 scale, with the 1 being a situation where the flow is very frequently stopped. So the student seems to have to think, consider, look around, or consult someone in order to know what the next move is while they're performing the 3-layer closure. 3 is a student who has some forward planning. They seem to know the direction that they're going. They've got a reasonable progression through the tasks. That's a 3. And a 5 is a student who has obviously planned the course. They know what all the steps are, they're comfortable going through those steps, and they have effortless flow. And so the words here that kind of help me to know where to place these students would be that they're frequently stopping versus reasonable progression versus effortless flow. And those help me to know where to place these students. And so some of the flow of operation mistakes you may see students remove and replace sutures, and that's going to disrupt the flow of the operation as they're going along. You may have a student who hesitates when selecting which tissue to suture, so they continue grasping suture and looking at layers and setting things down and picking things up because they don't appear to know which tissue to suture. Or perhaps they really did select the wrong tissue to suture and later they had to go take it out and replace it. Maybe they hesitate when they're choosing a suture pattern, or they're really not sure how to perform this pattern, or they choose the wrong pattern altogether and they end up having to cut it out and replace it. And finally, some conclusions to help us to decrease rater error as we're scoring these videos. The first is just to try to use the entire scale. So that's 0 to 3 on the checklist, that's 1 to 5 on the global rating numbers. And it's true as we evaluate the pre-videos, I expect we'll see more of the lower end of these scales, and we may very well not see anyone on the high end of these scales because these are novice students. But in general, we want to have good use of all the scale numbers wherever that's possible, and hopefully in those post videos we'll see more central tendency and maybe a few higher scores as well. We want to watch the entire video undistracted in one go, and go ahead and score each movement as it takes place. So if you miss a movement, you can go ahead and back the video up and watch that movement again in order to score it. Naturally, you'll need to wait until the end of the video to do the global rating scales. In general, try not to assume that because one aspect is good that all aspects are good, or that because one aspect of the performance is bad that all are bad. So try not to get caught up if the student starts poorly. They may still end really well. We may have the opposite happen. Or they may have poor knot tying skills, but their instrument handling and their flow are actually quite good. So we do need to score those as separate issues. And finally, refer back to the scoring guidelines as needed. So we'll want you to go ahead and print out your rater rubric so that you have that in hard copy to refer to as you're scoring videos. Anyway, so it's time to go ahead and score some videos, keeping these things in mind, and hopefully having the least amount of rater error that we're able to attain as we're scoring these videos. Thank you.